Allogeneic stem cell transplantation remains the only curative treatment for many hematological malignancies, but also non-malignant hematological diseases. And one of the major barriers for performing transplant has been the issue of donor. Historically, we've been relying on HLA-matched sibling donors. Then progressively, the unrelated donor registries expanded, and then we had lots of unrelated donors. However, we need to bear in mind that unrelated donors can be found mostly for Caucasians, and this can take some time. This is why the advent of haploidentical donors has been a huge advance in this field. Today, I think it's really an exciting era because we do have different type of donors which allow a given patient who is in need of transplant to have access to a donor. What we can say, and although we don't have yet final conclusions from randomized, robust phase 3 trials, however, at least in our experience and based on the registry data, the results are almost equivalent. I think the most important question today is that if a patient is in need of a transplant, just go for the rapidly available donor. If it is a matched sibling donor, then it's perfect. This is the classical scenario. If we're talking about unrelated donors, well, definitely, especially when it comes to 10 out of 10 unrelated donors, results are really very good, especially if you use ATG in the conditioning regimen for GVHD prophylaxis, and this would lead to a relatively very low incidence of severe acute and extensive chronic GVHD. And in the case of haploidentical donor, actually the use of post-transplant cyclophosphamide has been a true breakthrough. And obviously, with these results, post-Cy is also being investigated with the other types of donors. So you can see, in summary, I think today the goal for us in the field of allotransplant is maybe not about, say, how I'm going to choose the right donor. I would rather say, let's go to the most rapidly available donor, get the transplant done, and then focus on the post-transplant maintenance, because we are transplanting more and more patients who are really very high-risk disease. And the major risk is disease progression. This is the first cause of failure after transplant. This is why immune modulation and interventions after transplant are crucial in order to ensure the success and the long-term outcome for the patient.